Health experts warning that Myanmar is in danger of losing its battle with HIV. Currently, the country can only afford to treat a third of its more than 120,000 HIV patients, and that's with international help. But with the future of foreign aid for the disease uncertain, the situation is now looking grim. Our senior Southeast Asia correspondent, Sujadi Siswo, with the details.
This is where the battle to save lives from HIV takes place in Myanmar. There are 23 such clinics run by Médecins Sans Frontières or MSF in several states and regions considered AIDS hotspots.
With primary care facilities severely limited in Myanmar, HIV clinic like this has been at the forefront in treating patients. It's located near the community and in most instances has been the first to detect infections.
MSF clinics only started providing free treatment in 2003. They scaled up their efforts 2 years ago after receiving aid from the Global Fund, an international institution focused on disbursing resources to prevent and treat HIV and AIDS as well as TB and malaria. But the disease had already gotten out of hand.
It is estimated that there are like 125,000 patients who are in need of treatment, HIV treatment. But at the end of 2012, around 50,000 patients are on the treatment, so leaving the gap more than 50%.
Lack of access to treatment is one reason for the premature death of the 20,000 people who die of AIDS in Myanmar annually. Currently, only 1 in 3 patients receive treatment, but even then, only after a long wait. There's just not enough money to treat everyone. The government has done little, with only 4% of the budget allocated to the health sector. With limited resources, MSF clinics could only provide the antiretroviral therapy, or ART, to patients who had already reached the critical stage, way below the WHO standard.
The patient is very severe, so we treat every cause of the infection, but they can handle it very slowly.
This 34-year-old woman is one of the lucky ones to respond to the treatment.
She only
found out she was infected with HIV after her husband passed away from the disease. Her 11-year-old son tested negative. She represents the changing profile of Myanmar's HIV/AIDS patients.
In the past, we mainly found the infection in the high-risk, let's say, groups, like the female sex workers, male people, and the IDUs. But now it is changed more to the general population. We see in our clinics, most of the patients are from general population.
The HIV population is at even greater risk now. Funding from the Global Fund will only last until 2015. And experts warn the consequences might be devastating if no new source of funding is secured. Sujadi, Siswo, Channel NewsAsia, Yangon.